This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story Podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care helps me restore my faith and reinforce my call into the practice of medicine. I am Dr. Erinn Harris of Harris Internal Medicine, and this is my DPC story.
Dr. Erinn Harris is a board-certified internal medicine physician with specialty training in functional medicine. She graduated from Earlham College with a BA in biology and from Indiana University School of Medicine with a doctorate in medicine. She completed internal medicine training at Emory University and functional medicine training through the Institute of Functional Medicine. The DPC model has allowed her to spend more time with her husband, homeschool her children, and enjoy the things she loves. Welcome to the podcast, Dr. Harris.
Thank you. Thank you for having me.
It's my pleasure. It's been a few months, but I was super excited to just walk down the hall from Dr. Krista Springston's grand reopening. And there you are with your own clinic, literally down the hallway. So it was so great to meet you in person. And it's so great to even have a longer chat with you today.
It was great to be here.
So, going back to this idea of you guys are literally down the hall from each other, it really embodies the whole idea of if you've seen one DPC, you've seen one DPC. You guys are both internal medicine physicians. You guys are both thriving, and you have been thriving for years. And being an early pioneer, especially in the state of Georgia, I want to ask about your journey, a lot of the foundations of your journey, as well as what's going on now in your practice. So I wanted to start with your journey into medicine, because, reading on your website, your journey about your own diagnosis with vitiligo and just being a patient when you're training to become the person who takes care of the patients is very different. And for those listeners who have a chronic diagnosis of whatever sort, asthma, a dermatologic condition, a mental health concern, it's very different when a physician becomes the patient versus when a non-physician becomes the patient. So what drew you into medicine specifically that was impacted by you becoming a patient?
I had this conversation with my father just last night. He was like, I never asked why you went to medical school, why you went into medicine. And honestly, it wasn't always something that I thought that I would always do. I knew that I would be in science in some type of way. I just didn't know if I was going to do bench science or people science. And so I decided to do actually research of the amoeba that causes encephalitis when you swim in pools, is Naegleria. So my lab was right above the medical school admissions office. And so I realized I didn't like lab bench work, and I decided to go to medical school. And so I just didn't know which one I wanted to do. And I ended up basically just loving medicine, everything about the human body. That's how I ended up as a physician. There wasn't anything like pretty or sexy or anything like that. It was just like, hey, I think that's what I want to do. That's pretty.
I go back to that time in my own mind about, being an undergrad, being a pre-med, and then like looking at all the medical students like, oh my God, there's a medical student, like they're a celebrity, and it's very interesting when you're on the other side of things and you're like, dude, that was not even like there was no celebrity going on there whatsoever.
No
We were,
celebrity.
yeah. So
We were
I
funky, stinky, not having any showers, any of that. Nothing cute about it.
oh my gosh, continuing to live in jammies. I remember I did that for the first 2 years, especially when it was book work in medicine. But I love that.
Exactly.
It's like it doesn't have to be sexy. It doesn't have to be sensational. It's like when somebody realizes that, I'm gonna do a lot better with my career if I'm around people versus if I'm around toys that I'm, pipetting with and stuff. It's a different world. And I think it's important for people to hear that, because there might be some people who, I know a person in medical school in my husband's class who was pushed into going into medicine by his family because everyone's a doctor and that was the culture. And for some people, like my family, nobody in my family, in my immediate family is a physician. So I think it's important to recognize, whatever it is, it's in alignment with what we want to do. Amen. So when you were going down your route of becoming, a physician, you're in medical school and residency, and you had shared in your bio on your website about how, you were frustrated with the way that you were being treated as a patient and the treatment you were not getting. You started being open to other causes of vitiligo specifically. And your website mentioned how I think it was your husband found a video about copper supplementation that somebody was using to treat vitiligo and it worked. And then I wanted to ask about that because I really saw parallels reading your story on your website to you being, a trailblazer in Georgia and opening your own DPC. And the reason I say that is because you didn't just, okay, this is what the doctor said, I'm just going to go along with it. You didn't say, okay, everybody else around me is going fee for service, I'm just going to do that. Is there any relation to the way that you took the reins of your own health determinants? Does that relate at all to why you took the reins on your career and opened a DPC?
Absolutely. Absolutely. So just to kind of give you my backstory for direct primary care and how I got into it, I don't know if you wanted to lead into it, but it was a continuous story. Honestly, it was hard to really break up how I transitioned into functional medicine. But back in 2012, I can really remember at that time, I decided I was burnt out. I was not, and it was early into, fee for service and insurance and documenting and Medicare and all of those things. And I knew at that time when it all started, I was like, I'm not going to be a part of this. This is way too much. And so I was burning out. I went to the VA and I was like, oh no, what did I just do? And walked into the VA and said, I have to do something else. And really started looking at other practice models. I said there was concierge. Well, concierge didn't make much sense because why are you charging insurance and then you're charging an extra fee on top of that? And then I saw a video with Garrison Bliss and Erica Bliss on YouTube. And I was like, this is it. And I think I was reading something in, I think, Medicine Today or one of those, kind of business medicine magazines, and saw this article. I think Garrison Bliss was in the article. And I was like, this is it. And was nothing. I'm telling you, nothing to go on except for what I was reading. And the only thing I would read in articles or I would get online and hear, forums, I'm speaking forums, and that's it. And so I don't know what I was thinking about, but I knew in 2013 was very pivotal in my life because two people were diagnosed that were really close to me for breast cancer. My sister and a really good friend of mine. My friend passed away. My sister is survived. She's passed away that year, but I was like, I'm wasting my life. If I continue to do this and continue to not be happy with what I'm doing, this is not profitable for me. And so I literally in we had this thing in Atlanta called Snowmageddon and was all over the world where everything stopped. Do you guys remember that? It was literally my dad was like, I was on a boat in St. Croix and I saw that you guys can't move anywhere on the highway. And I was like, and so I was literally in my house in January 2014, trying to figure out what I was going to do in my life, found DPC. And by April of 2014, I had my LLC, well, my PC at that time together, and started a business and started practice. What the heck was I thinking? I had 0 patients. I didn't have any patients. I didn't have anybody. I didn't know the model. I was just kind of piecing everything together and just going by what I saw. I started off per patient fees and then went into membership and started off with 1 patient, literally 1 member. And then the next year I had 5. And the next year, I think I had 15. But how I transitioned is because I realized I absolutely loved it. I absolutely loved the time I spent with my patients. I love the fact that I could determine what I wanted to determine, how I wanted to spend my day, what I wanted to do. And I still had to do a lot of moonlighting in order to, because I was the main breadwinner in the family at the time. And so I had to do a lot of moonlighting in order to support in a sense, my habit of DPC. But it allowed me to spend a lot of time with my patients. And as I spent a lot of time with my patients, I saw that there were other things I couldn't address. I just didn't understand. Well, I didn't have the tools to understand what was going on with them. Why did they have anxiety and why did it improve with folic acid? And what's going on with their gut and why did it, how's this? I know it's interrelated some type of way. I just don't know how, but I had time to figure it out. Being able to spend time with my patients, I had time to figure it out. And then my husband said, hey, you know what? You've been really looking into this vitiligo thing. I saw this video on YouTube of a woman who healed vitiligo with copper, and it literally took me down my rabbit hole. And I think I was at the DPC conference either in DC or Indianapolis. I couldn't remember one. And one of my colleagues was like, hey, Erinn, he also transitioned into functional medicine at this time. You may want to look at estrogen metabolism. And he was speaking like literally foreign language to me. I was like, what? Did we really learn this in medical school? Or did I go somewhere else? And so I spent a day in his practice and that was it for me.
That's awesome. Let me go back. One of the things that you said that really piqued my interest here was when you talked about before you transitioned to DPC, as you had seen the video and you read the interview featuring the Blisses. I'm wondering about when you said the future wouldn't be profitable if you continued on your journey in fee-for-service. Because when you say profit, what does profit mean to you? Because as we're finding by, when I speak to many people who've chosen DPC, profit is not always dollar signs. So when you said, to yourself, this is not going to be a profitable way for me to continue going forward, what did you see in your future? Imagining that crystal ball of like, you could see your future if you continued in fee-for-service. What were the absolute turnoffs that translated into it wouldn't be profitable for you?
My time and my freedom. I wasn't able to determine how much time I spent with my patients. I wasn't able to determine how much time I spent with my family. I wasn't free to make choices that I wanted to make for my patients that I felt like were necessary. And nor did I have freedom to make choices that, with my family. Oh, I want to go here for vacation with my family. I need to spend some time, or I need to actually cut this day short a little bit because I actually want to go to a game, or I need to homeschool, or, there are a lot of things that I wanted to do that I wasn't able to do as a fee-for-service physician. So yeah, what I felt like was a value was not money, it was time and freedom.
And as you chose DPC as your hobby. I love that's, you're referred to it in the starting out years. Noted that you had your moonlighting going on, but I want to ask you about how you mentioned you were initially opened as a PC and then now an LLC. So in the state of Georgia, were you able to function as a medical doctor with a PC, or did you have to have a different type of corporation like an LLC to continue growing your DPC?
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
No, actually, you could choose either one. You could be a PC or LLC in the state of Georgia. So some states you only can be a PC or a LLC or something like that. But in Georgia, you can choose either one. I just decided I wanted to structure my business a little bit differently for tax purposes. And I chose to, and only in a PC, the only members could be individuals and not other entities or other LLCs or individuals or, other type of entities. And I just decided I wanted to structure a little bit different. So I switched. I think it was in 2021.
Got it. And how was that switch? Because I haven't actually heard anyone say on the podcast about that transition specifically. Did it require much work or much legal fees to transition from one to the other?
No, but I would tell you, learning from my mistake, always keep your EIN number, because I didn't realize that there are always mistakes in business, but I was like, what? I was supposed to keep the same EIN number? I didn't know I could do that. And so once I closed the PC, I couldn't backtrack and change it. They were like, no, sorry. So that was the one mistake that I made. It's kind of like you had to start all over again with business credit.
Gotcha. Now, let me ask you, because at the time you opened, there were a lot. The number of resources were very different than the number of resources that there are out there now, including people listening to your story. Like, this is awesome that you were able to share, with even more people, in addition to your dad, like about why you went to medical school and opening your DPC. But when you chose the name of your clinic, let me ask you there, because with us talking about legal transitions, did your company always maintain the same name, or do you have your clinic as a DBA?
I had it originally as I basically had no idea what I was doing, and there wasn't a lot of resources to tell us. They had these really cute names like Plum and fruit of vine, just like really, and I was like, me, Harris. I just did Erinn Harris, MDPC, and I did a DBA as Harris Internal Medicine. And when I think you had said something about, well, did you think about adding on partners or anybody at the time? I was like, no, I just originally thought it was just going to be me, myself, and I, and that was it. And so I was just like, okay, I had no thoughts of becoming large. I just thought, oh, maybe 100, 150 patients, maybe 200, but that was it. And I never thought that it would expand the way it did, especially the fact that I really didn't start expanding until 5 years in. So I kept at it, 5 patients, 15 patients the next year, 25, and then 50. And then it just explosion in 2020.
It's crazy because, you're referencing a year that the world was very different, not as a little bit more different even than Snowmageddon. But when it comes to, that magic number 50, it's very common for practices to hit that. Well, there's 50 patients who are telling one person a day about your practice and how oh, I'm so sorry you had to go to the ER. I just called Dr. Harris for my acute issue that really isn't acute. And I think it's really important for people to hear that because there are practices, whether it be, DPC doctors who are moving to a community where they hadn't practiced before, or a person who is in their same community but weren't really known as more than a part of a corporation. And there are people who are asking the question, how come growth is not in the hundreds? And for some people, like you pointed out, the goal is not to reach 1,000 patients for most people in independent DPCs. The goal is to focus on personalized, accessible, affordable care. So when you talk about, or when you think back to this time where you were doing moonlighting as well as having, 1 patient, 5 patients, 15 patients, and you just kept at it, what were some of those things that you could share with us in terms of self-talk that you had about, I got to keep this going. What am I doing? Anything that might be going on in other people's minds and other listeners' minds, as well as what was it that, kept you at the end of the day, not choosing to go back to fee-for-service or not choosing to close your practice and go to strictly moonlighting gigs?
Well, I did. To be honest with you, there were several times I was like, well, maybe I should just, it's been 5 years. They said 3 years is when you should cut it off. I thought about maybe, just decreasing my practice or just keeping the small amount of patient and just closing maybe at 20 and then doing just moonlighting. But every single time I made that decision, honestly, the phone would always ring. And I would be thinking, how did you get my information? Who, where did you come from? And it was always a sign to me, I just need to keep going and I just need to stay open. And as I did that, more people just continue to come. But it was difficult during those times when you thought, oh, what am I doing wrong? I would go to DPC conferences and they would be like, oh, I got 100 patients in 30 days. And I was like, and I don't know if you guys know Jeffrey Gold, but he opened right after I did. And I was always on his tail. He never knew it, but I told him during a conference one year, I was like, Jeff, I'm always on your tail. I'm always following you. I was like, well, if he can do it, I can do it. And I was like, obviously I had the mindset of it's not impossible if everybody else is doing it. And if it's meant for me to do, then I have to just stick in there. And maybe there's a reason why I haven't grown. Maybe I have to develop my foundation. Maybe I have to work some kinks out. Maybe I need to improve my systems and processes. So when I do grow, my foundation is strong. So when I do grow, maybe I need to have a strong foundation so it won't fall. And so there were a lot of things when I look back. I got pregnant, during my first 2 years. And so I had a small baby. So there were a lot of factors involved. So if I had it grown really quickly, then I had a small baby.
That's awesome. And it's funny because your small baby was watching some kids show with my son when I was in Atlanta, and I was like, hey there, I don't know who Asher walks up with, and they're like, can we watch a movie? I'm like, sure. Let's sure. It's hilarious. Your baby is still coming to the practice and seeing how awesome his mom is doing. Love it. But, talking about these first 5 years and you not growing in numbers like you had seen other practices doing and still persisting, I want to ask about your finances and how did you view your overhead? Because with knowing you had 1 patient, 5 patients, 15 patients, and those first 5 years, were you in the same space that you are today, or did you change spaces as your practice grew in terms of patient numbers?
No, I was in a medium-sized space, but the price per square foot was very cheap. I think it was $11 a square foot. And so my overhead was very low. I always seemed to find a practice that I could just walk into. I didn't have to paint, didn't have to buy furniture. Somehow everything was there. and provide. I probably had to buy, a small amount of equipment. I practiced next to a OBGYN. It was kind of like a shared space. She was on one side and I was on the other side, and we shared the check-in area. And so I'm leased from her. She owned the building. I leased from her, but it was way back and I had to do a lot of marketing because people just didn't, it wasn't like out in front. And then even when I just had 50 people or maybe a little bit less than that, I had to take a leap of faith and say, I think it's time to move my practice, because she moved to Minnesota. I was the only one back there. And it was kind of like back in a cul-de-sac in a city, like right behind where I practice now. So I moved from a city called Tyrone, Georgia to Peachtree City, Georgia. And it really was a leap of faith, because that's when my practice boomed. It just took off. It was literally like 1 month, 10 patients, next month, 15, the next month, 20, next month, 25, next month, 30. It was crazy. And we were so glad that COVID hit, because we were able to breathe, because we were growing so fast.
I'm just like laughing over here because I'm like, where have I heard that story before? Going from Tyrone to Peachtree City. Like, that is so crazy that both you and Krista. Yeah, that's so crazy. Oh my gosh. For different reasons, but that's so insane. Oh my gosh. So it's just a side note. If you haven't heard Dr. Krista Springston's story, definitely listen to hers. She had an issue with a non-compete area, a geographical area. So definitely listen to why we're talking about that. But so let me ask you, when you say did you open with any of your current staff members, or did you have anybody virtually assist you in the beginning?
No, my husband was awesome with systems and processes. So I had me, myself, and I. It was just me. And
DPC of you.
Yes. And I was definitely a micro practice. I had UMA as a phone system. And so there was no one I had a front office or a front desk, but there was no one sitting up there except for me when I would check in somebody. And then I would go back to the nurse's station and check in the patient and do the wait station. And then I would go to the doctor's office and be the doctor. And so he was like, okay, when somebody comes in, how are you going to know when they come in? And so he had me work out all the kinks as far as like, well, how are they going to know? Oh, well, they can call. So what literally they would do is I had a sign out, dial this number in order to check in. I would come up front, check them in, take them back. And I had a whole system in place. And when I was moonlighting, say I was at the hospital, because I didn't take Medicare patients because I was still doing hospital work. I had my phone in my lab coat, and I would be with the patient. Thank God it wasn't during a code, but somebody would call in and, hello, welcome to Harris Internal Medicine. I would run out the room when I was seeing a patient in the hospital. Thank you for calling Harris Internal Medicine. How may I help you today?
That's very DPC, but also very primary care. Like that is dedication right there. I love it. Oh my gosh. So when you were moving into your new space and that's the space that you're in today, how did you then add on team members? Because you're saying that your husband was very good at systems and processes. At what point did it go from being you wearing all the hats and him helping out on the admin side of things, and then having an actual team member join your practice?
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
When I feel like I could afford it, when I knew there was enough where I could pay a salary and I wouldn't be like, oh, I have to lay you off. When I'm pretty good at looking at numbers and forecasting and say, okay, I started Marley off part-time, and actually in the building, I was upstairs. So we weren't downstairs on that first floor at all. I had a 900 square foot space that opened up and 2 rooms. It was perfect and just enough space for me. So I didn't really necessarily change rent. I think I went down in rent a little bit when I moved into that space. So Marley started off part-time, and then I was like, okay, you can do 2 days a week and then 3 days a week. And then and then I said, okay, 4. And I think the next year I said, okay, I'm ready to stop moonlighting. So it was a gradual process.
Awesome. And when you looked at your financial outlook and you had the funds coming in to pay a salary, but also to say, peace out to your moonlighting gig, did you have any plans in place in terms of like needed to make sure that you had 6 months of, bill payment to be able to say bye to the moonlighting gig? Or how did you set your benchmarks to be able to make that decision and leave moonlighting?
Well, the thing about DPC is it's very consistent, and you can really determine what your growth rate is, and just simply by looking at previous years and forecasting for that year to come. And I said, okay, if I'm growing at this rate, then by next year or the next 6 months, I can afford to do X, Y, and Z. And so that was really not necessarily saying, okay, I'm going to stack 6 months back. It was mainly saying, okay, if I continue to grow at this rate, I'll be okay to actually stop moonlighting.
That's awesome. And it comes on the tails of somebody leaving a comment on our contact page about, like, how do the finances work in DPC? And it literally is simple like that. If you're doing a model where you have, and I shouldn't say simple because there's some, especially specialists who choose not to do memberships. But for those, especially who are doing memberships, it literally is this many members equals this much amount coming in. And then if you have one more member, they're paying that much more. Like
Exactly.
It literally is. It's not like, okay, today CMS is reimbursing me this amount of money. And so it's not like that anymore. So I love that. Now, in addition to Marley, you have Stephanie, Susan, and Kelly. And I'm not sure if you have any additional people running the front office, or is that your whole team today?
No, I had 2 people running the front office, and I did have to let go of one.
So let's talk about teams, because that's a big thing. Is people are growing their practices just like you did. You started out with you wearing all the hats. Your husband is in the background helping, but essentially going from a micro practice to adding on team member and then multiple team members, and then, as you said, at least letting one person go. Let's start with, how did you find your teammates, and how did you make sure that they were going to be a good fit for you, your practice, and your practice culture?
I promise you, every one of my teammates found me except for Marley. I worked with Marley when I was in fee for service, and I told her, just hang on. And she was like, okay, it's been like 5 years. How much longer do I? Because she was at my grand opening in 2014. And she was like, okay, how long? Where's it going? And so she was the only one I knew that I could work with, because I worked with her as an MA, and she was long gone from the practice where we worked together. So the other people found me. Stephanie, who's a nurse practitioner, she came in and said, hey, I'm a nurse practitioner student. I'm interested in doing, I need some work to do. She needs to be supervised. I was like, there's something about that girl. And I said, well, if it works out as a student and she fits in the team, then we'll keep her on. And it did. Same with Susan and Kelly, who are a health coach and a nutritional consultant. Basically, they found me. So Chelsea she's a new person up front. She's actually Marley's niece, and she's worked out really well. And Anisha, she was up front. I knew her as a longtime friend. However, she was wonderful, great. It was the hardest thing I had to do to let her go, because she was so good a customer service. But even when you're growing in a business, you realize, oh, wait a minute, I didn't even think about that. I was like, she doesn't have any medical experience. She's great at customer service, but you forget that you can't do what you do in fee for service. In fee for service, you can just have somebody up in the front answer phones with no medical background, and they just need to have, they may have a little bit, but they don't need to have MA training or anything like that. Can't do that in DPC. They have to have something. And I was like, wow, this sucks.
Oh,
Because she was great. She was great.
it just reminds me of when something changes in our practices, it's not a failure. It's definitely an opportunity to learn from, to go past. And I was reminded today, eating a humble pie myself around like a financial decision in my practice that, okay, like also remember that we are very fortunate in terms of like, we can say like, okay, we still have house and home. We still have food to put on or money to put food on the table. And now we're going to pivot and make another decision. And so, but when it comes to having a conversation with someone, especially someone who you care so much about, and you're very fond of, who is doing amazing customer service in her case, any tips on how to have uncomfortable conversations, especially when it comes to letting go of a person?
That was hard. It was hard. I really had to. I went back and forth, back and forth, back and forth. It's going to work. No, it's not. It can't. It wasn't that she was doing a bad job. It wasn't that she was really making mistakes. It was the fact that I can't grow without. So what I did, okay, let me tell you what I did. I have a mastermind group that I'm a part of, and asked them, I need help. This is what I need help with. And they gave me a lot of good ideas of what to do. And I took a lot of their ideas. So what I did was offer her a way to expand with the practice. You're awesome. I gave her, you're the greatest at customer service. However, I know you haven't had any medical experience. Therefore, I really need somebody with medical experience. Are you willing to get medical experience? If you, I'll help you with that, or I'll aid you in that. And that's not what she wants to do. And I was like, well, unfortunately, we can't continue. It really ended on a great note. And she was like, I know that I was here to help you when I needed to help you. And, I was like, if you need any help finding any positions or any references or anything at all, that's the way we ended. It was very positive.
I think it's so helpful for people to hear that, whether they're listening to this recording when it comes out or, years later, because it is not something, as DPC owners, we went to doctor school. We didn't go to HR school. We didn't go to other schools. And and I think especially for physicians who do care about who comes into the clinic to work as part of the culture, it's not a comfortable thing that, we'll have people signing up to do, right? Like that's not usually a doctor who would be the firer in a company. So I appreciate you sharing that experience. And I think that for those people, I've talked to so many who are like, well, this person is the daughter of so-and-so in the town, or this person is like not doing their job or whatever. And there's different reasons to, find that this is not going to be a good fit going forward. But hearing, the little bit of agony there, like I can't, like that's normal, totally normal. Yeah. But it also means you care. You care about the person and you care about the practice. So I think that take it how you will, but take Dr. Harris's experience as this happened and she still ended on good terms, so I think that's awesome. So let me ask you about when you brought people on and they, you said how Kelly and Susan found you. Did they find you through functional medicine connections or word of mouth connections through functional medicine or internal medicine or both?
I think Kelly found me. I spoke during COVID, just about COVID in general. And I just felt like it wasn't like I was at that point wanted to drum up more business. I just felt like the people in my community need to know about, it was so many kind of things going out there that weren't untrue or answering questions. And so she has started her own private, health coaching business, and she wanted to partner with me. And that's another thing. That's what I love about DPC is you can be creative of how you partner with people, because I didn't hire her. She's just an independent contractor. We worked out something where, if you see so many patients, you get this much a month. And the same goes for Susan, same thing. And they complement each other very, very well. One is stronger with nutrition. The other one's strong with health coaching. So it works really well for the practice.
Awesome. And in terms of when they see patients who are also your patients, how does that work space-wise? Do they see them virtually? Do you guys come into the office at different times, or do you have space for everyone to have their own room when they need to see a patient?
Yeah, it's really up to them. Some patients want to meet in the office. Some patients mainly virtually, they mainly meet virtually, or they meet at Starbucks or just wherever they decide to meet.
Gotcha. And when it comes to you learning about functional medicine, deciding to, add functional medicine as a component to your internal medicine practice, were there any issues legally adding functional medicine to your practice in the state of Georgia?
No, not in the state of Georgia. The one thing, there was a podcast or a seminar on a patient not on a patient, on a physician who transitioned her, I think it was a fee-for-service into functional medicine, did a membership-based functional medicine practice, and didn't know anything about her. And I was like, wow, she did exactly the same thing I did. It was like we had like minds, but never knew each other. And I was like, a very similar setup. So her husband is a lawyer, so he has a platform to help functional physicians practicing functional medicine who are also doing a membership-based model. A very tight niche. And so I learned just some things from him and said, okay, I just need to tighten up here and tighten up there, just making sure that people, because maybe functional medicine may not be okay, as the more that you learn about it, the more people learn about it is okay. It's just a practice of medicine. I say on a biochemical level, that's how I see functional medicine. But you just have to make sure that you have a waiver there in place that IFM or the Institute of Functional Medicine already provides for you. So they give you a lot of kind of help business-wise to say, here's a waiver, you already have a waiver, here's a waiver for bioidentical hormones, here's a waiver for functional medicine, here's what to expect from functional medicine. And so we put a lot of those things in place, put a process in place where we do that digitally, and ta-da, it's done.
Awesome. Yeah, it's very important to know what's going on in your state legally when it comes to even things like nutrition. I was reading how in California, anybody could be a nutritionist because there's no degree that comes with that versus a registered dietitian. And so for someone to be giving medical advice, whether it be nutrition or, a Western medicine like blood pressure medicine, definitely pay attention to what's going on in your state. But that's awesome that you were able to get guidance and just a little bit more, not only from IFM, but just from talking and looking at your practice through a legal lens, how you were able to say, like, this is what I'm doing. I just need to protect how I'm doing it. I think that's awesome. So let me go back to your patients. You said like with the first few years that you were doing per visit, and how has your pricing changed over time? And any tips on how to set pricing so it is in alignment with the service that you're providing?
So this is a very interesting story. I think you're going to like it. So, when I originally set out to do memberships, I think I was probably just 3 months in, and I was like, I had Rob Lambert, Bob Nelson, and we were the trio in Georgia. And I had called Rob. I don't know Robert very well. I know Bob Nelson a little bit better. But he was like, we're doing this memberships thing. I said, I'm doing memberships. Do you know I'm doing it through QuickBooks. Do you know what's out there? And he said, I heard about this thing called HIT. Isn't that crazy? That's like, I heard about the telephone, Right. And so he said, yeah, I heard about this thing called HIT. It looks really promising. I think that's the way to go. And so but in between that time of trying to figure out HIT and how do I get into HIT and who is this HIT, I ran into a consultant. It's the same consultant that consulted with Jeffrey Gold all the way in Massachusetts. And he was like, oh no, because I started out, I looked at everybody because that's what I would do. I would get on everybody's website. I would get on Atlas, everybody, Quick Lions, the Blisses, and see a typical charge. What was the average charge? Everybody was charging up to about $75 a month, between 50, 45, 70, even back then. And I said, okay, well, that's where I'm going to set my prices. They came in as a consultant and said, oh, no, you're not charging enough. You need to be charging more. $150 a month. Don't you think that's a little steep? 125. And that's what's actually halted my growth. And so I became so upset because I talked to Jeffrey later and he was like, yeah. Same thing happened to me. Same guy, same thing happened to me. And I was like, wow. So I went back to the baseline price where everyone is practicing. So you really have to charge what the average charge is, because it's kind of like, unless your bonbons are like soup, like have diamonds in them and you crunch and then you can charge, $100,000 a bonbon. If it's a regular bonbon, just charge, anyway, you get it. But I spoke with Josh. He was on it. It's such an awesome guy, because my husband said, I'm going to call Josh. I said, you're calling who? Do you know who Josh is? Like, this guy's been on Hannity. He's not going to talk to me. And so, and my husband called up Josh. It was the weekend of Thanksgiving, and he was driving to his family's home. And God bless Josh. I love him, because anytime he'll be like, yeah, I'm walking into, hey, Josh, are you available? Yeah, I'm walking into like the movies. I was like, what? But yeah, so he told me, yeah, your prices are too high. You need to go back to the foundation. And I started growing again. And so I really got kind of bitter, because I was like, I should have listened to my gut. That's whatever. I knew I should have been charging those prices, but I learned a good lesson that's, you charge where kind of like where the baseline charge is. Now, to go up on charges, I probably have increased my prices by $10 to $15 since I started at the most for primary care. Now, of course, my functional medicine prices are in range with the rest of the nation, but still have to be a little bit higher because I see less patients and I do more time. I give them 2 hours on their first visit.
And in terms of how if a person is coming into your practice, I asked the same thing of Dr. Tammy Singh, who's doing functional medicine as a family medicine doctor down in Florida. How do patients find which pathway they're going to go down, whether it be primary care under the internal medicine membership or functional medicine?
That's a really good question. That's a question we had to figure out, because there were a lot of patients that we were seeing at the time that were really functional medicine patients. And I hadn't turned the switch on for functional medicine yet. And so we had to give them a choice to say, hey, this is what we're doing. We're going to switch people who are really functional medicine over to this price point. And we have to make that determination patient by patient. There are some people who try to slide up under the radar and use the nurse practitioner as, for primary care, which is something else I thought I would never do, is hire a nurse practitioner. I was like, oh, no nurse practitioners, all physicians. But she does a great job, and I needed the help at the time. But that's another story for another day. So she really communicates as far as like, I really think this person is functional medicine, but I really think they're trying to, just slide up under the radar. But we have to be very stern with them and say, she's not trained in functional medicine. I am. This is a functional medicine issue. If this is the way you want to go, you really need to switch over.
And in terms of your patients, if they are both functional medicine patient as well as a person seeing you for, pap smears and just annual regular things that aren't necessarily needing the same time as a person who is seeing you for a functional medicine visit, how does that work out? Do they maintain their membership and get a different price for doing functional medicine plus membership?
No, so everybody's a member. So you still pay the monthly membership. It's just a higher price point for functional medicine. However, I'm still your primary care doctor, which I think a lot of I think is the cool thing about direct primary care and the model is you can do anything you want to do. They're like, you can still write my prescription for yeah, I can still do that. And I can still do your PAP and I can still do your breast exam. I can still take that thing off. Let's snip it off right now. Why I say I can still do your biopsy, but I'm also your functional medicine doctor too.
Awesome. And in terms of your way of practicing, especially at the after visit. So, given that functional medicine visits, any DPC visit, especially the new patient visit, you're going to find more time is spent on that, on any visit in DPC, whether it be functional or not, just because we're DPC and we're not bombarded with number of PEDs seen per day, number of codes brought in per day. So as a doctor who is having the time with patients, how do you go about the after visit? Because especially in functional medicine, with different types of supplements, understanding where to go for, information on that's not fake news or whatever about supplements that you might be prescribing, and also setting up a patient for success if they have, shucks, I forgot what Dr. Harris said because she said a lot during 2 hours and I'm not sure what she said. How do you set your patients up for success after your visit, whether it be functional or quote unquote Western internal medicine?
Yeah, that's a really good idea. We just had a staff meeting about this last week, is really still the importance of putting those systems and all those processes in place to make sure that, because if somebody decides to leave the practice, that we do an exit interview with them and fill out what could we have done better, what was the reason why you're leaving, how can we improve. And one person said, well, making sure that we have a list of things that we need to do, or that there's something that we can go by when we leave, because there's so much information we'll forget. And I was like, wow. So we decided to do a form where we'll check off, and we'll have like a general form, and we'll check off, you're going to do this, this, and this, and this test. This is how much it's going to cost, and it's really just something that's really laid out. It's in the process of doing, but that's one of those things about great, if you're really an entrepreneur at heart, that's one of the things that you love to do is like, oh, we could do this better. Let's do it better. That's
awesome. And I think that it speaks to the freedom that you chose when you decided to open up your own practice. Because I think about, in 2014, just by happenstance, I mean, it's like other doctors, like Dr. Emily Scott, like just by happenstance, you read this article or you saw this video. It's like, things happen for a reason. It's like when you were like, I'm going to close, somebody calls, it's so cool how things like that happen. But, I think about how you've grown so much over time. And so I want to ask, when you have other people who are clearly like in the Georgia area, I'm so jealous because there's so many doctors, like Dr. Michelle Cook was at Chris's grand opening or re-grand opening. And, Anand Mehta's down he's 45 minutes away. Yes. I mean, it's like super jealous of your guys' location. But as other doctors are, definitely reaching out, whether they be functional focused or whether they be just wanting to know about DPC, what big pearls, what bonbons filled with diamonds do you give them when they're saying, hey, Dr. Harris, like you are a pioneer in Georgia and you're a pioneer in DPC. What are some of the big tools that you always pass on to others who might be asking about DPC?
What I would always tell people is start off slim. Do not overspend. Don't go big. Don't do any of that until you're way into very stable ground. Get used things. Even when I opened up the bigger practice, I still got used furniture. I didn't, it looks the same. Nobody can tell the difference. It's not torn. Great. But yeah, start slim. Don't go really, just have a slim practice that's very efficient. Don't hire more than you need to hire. Don't have a front person up there if they're not being used for like 5 different things, so it's just, be very efficient and very effective at how you run your practice. I think is the best thing, because a lot of people want to have marble in the front and they want to have the thing that looks the best on Instagram. And I have one little area that has some pillows and a chair, and that's the best part. And I always take that picture. It doesn't mean the rest of it looks horrible, but I'm just saying I don't have $1 million practice, and it's not important to have that. And if you're taking care of people aren't really going to care if you have marble everywhere if you treat them poorly, and if you're not going to be open in 3 months because you can't keep up with the bills.
I love it. And as I was listening to you just say that, it makes me think of Dr. Clodagh Ryan had dropped this gem of there is marble that is in the form of contact paper that you can stick on counters and people don't know the difference. But also super true. But you called it out. It's like patients aren't looking for $1 million clinic. They're looking for $1 million doctor. So with that, thank you so much, Dr. Harris, for sharing your story today.
You're welcome. Thank you for having me.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.